Hello. Let's go ahead and get started since it's 3 o'clock now. Okay, so hi, my name is Jane Kim, and I'm really excited to have you join us today. The topic for today is COVID-19, perfect dangerous storm for children and youth. And I'm excited to share with you today. I just want to warn you that there's a lot of information and I'm trying to condense it all into 1 hour. So I'm going to jump through the slides. If you have any questions or you feel you're not satisfied, please go ahead and type your questions or your comments in the chat bar on the side, and we'll try to get to them afterwards. Thank you. I'm sorry, I'm having a little bit of a technical difficulties right now. Can you see me? Okay, great. I'm sorry, let's start over. Hi, I'm Jane Kim, and I'm delighted to have you join us today. The topic for today's presentation is COVID-19, perfect dangerous storm for youth and children. So I just want to let you know that I have so much information and I'm trying to condense it into 1 hour, so it's going to be impossible to get through it all. I'm going to go ahead and skip through the slides and make sure that I get you the gist of it. Make sure you get the content. If you have any questions, please feel free, or comments, to type them in the chat bar on the side, and we'll try to get to them as many as we can afterwards. So I really hope that you appreciate and enjoy the information that I was able to find for you. So let's get started. Before I start, let me just give you a little bit of my background and who I am. I'm a licensed marriage and family therapist. I've worked in the field of mental health for 15 years. I've worked with hearing and deaf families, college students with in a variety of settings in the community, in their home. And my strength is assisting these people. In January, I finished the pupil personal services credential to work as a school counselor. So I enjoy working in the field. Oh, I forgot to inform you that every slide that I go through, I'm not gonna go word for word. I'm just gonna condense it. So I have this slide that you can use as a resource for yourself. And as you are aware, COVID-19 has been a global pandemic, and it has affected many people so many different ways with this unprecedented crisis. It's the school closures has forced many people to stay at home, which has caused abuse and to decline sharply, including neglect. So the change was far from good news for child welfare workers. Many people that work with children and youth have seen this. It's hard to recognize or see if there really is some sort of abuse or neglect going on in the home. And I also want to add that research shows that when parents are stressed out or a caregiver, that usually leads to perhaps a trigger, increased depression, to neglect, even if they do have a good relationship with their children. And children depend on their support system, taking care of their kids, extended family, church goers, and many of these resources are at risk and are no longer available to many of these families. Plus, with COVID-19, a lot of people are getting ill or sick, many medical workers also. Not just that group, but parents who have a great relationship and great management skills great bonds with their kids are going to be tested. And this is all due to the pandemic that we're in. So there's a perfect storm happening in millions of homes for children who are at greater risk for abuse and neglect. Here's a list of objectives. As you can see, there's many of them, but we're going to skim through them. I'll touch on a few topics and dig a little deeper into those. Statistics, facts. Most of the data that has been collected is related to hearing children. There is some for deaf, but most of it is outdated, and hopefully will be researched again later in the future. Also, children that are in vulnerable situations, children that are neglected, are usually increased. As you know, that coronavirus has impacted many people in many different ways. Feeling worried, fear about your own personal health, the health of loved ones. And that fear also impacts older children. It impacts medical care providers, teenagers, people who work very close with patients in hospitals, nurses, doctors, other healthcare providers. People with mental health issues, feeling isolated, the isolation becoming increasingly worse. Low-income families, children and families that have language barriers. Also, you know, where people have heard the idea that this pandemic, this virus came from China, you know, also experiencing this kind of discrimination. COVID-19 causing stress on families and caregivers. As you can see, the list is long, but I would like to emphasize two factors that impact this kind of stress. Obviously, unemployment, being without a job, and many people's employers closing because we were ordered to shelter at home. Being home with your child 24/7, schools being closed, school being transferred to online, and also parents having to work from home and deal with taking care of children and working, which causes their stress levels to increase dramatically. The effect of COVID-19 on children and youths. As you already know, the families are struggling to adjust to new routines in response to COVID-19. And it's important to recognize and support these children who are experiencing increased feelings of fear and uncertainty. Young children have a difficult time talking about their fears, and it can manifest and show itself as stress. So in the next several slides, we will be discussing children, tweens, and teenagers' behaviors, the signs that we see, which some of you might already know what these kinds of signs are and look like. So now with the crisis in mental health care, we see that many people are struggling with these issues at home, and how all these issues are dramatically increasing, especially if somebody already feels isolated, is already feeling anxiety or depression. In the news, the most recent news that was reported by Bay Area Trauma Center, shows that a year's worth of suicide attempts has occurred in just the past 4 weeks when the country was ordered to stay at home. Wow. So that reflects what's going on all across America, not only America, but the world as well. So now I'd like to discuss a little bit of young children. I'm sure that you've seen, or maybe through your work, your home, or maybe your own kids, some of these behaviors. Some kids might have signs of regression, beginning to act younger than their age, asking for bottle instead of a cup, regressing with their toilet training skills. Older children may show their shorter attention spans or have difficulty sitting still. Also emotional issues such as frequent crying, angry outburst, fear of being alone. And I'd like to emphasize that it's more than normal. Maybe some young children, you might notice that they become clingy with their parents. They want to spend as much time as possible being close to their parents or their caregivers because they're afraid of the uncertainty that they may face. Some other children maybe have difficulty sleeping. Some might fall asleep with their dog. And it's all could be connected to coronavirus. Some might be playing doctor with the doll and telling the doll that they need to stay home because you don't want the doll to get sick. So sometimes that's mirroring what they're feeling inside. Before I discuss this, I want to make sure that you're all aware of what the word tween means, or tweenager. I like that word. I think it's a really neat word. A tween or a tweenager is any child, boy or girl, between the ages of 9 and 13. They're not old enough to be a teenager yet, but they're past the younger infant child age. One thing that is different about tweens is that they tend to show a little more anxiety, which is not related to the actual illness, but mostly just, you know, all of a sudden their world being changed. They're no longer able to socialize with their friends. They're no longer able to do things, and sometimes parents are like, hey, I'm busy, but with this coronavirus, everybody being forced to stay home, everything is kind of put on hold. They're more worried about parents going to work. What are you doing? Why are you leaving? Sometimes they'll leave the lights on or sleep with the door open. You know that teenagers, they're infamous for wanting to be away from everybody, closing the door. But teenagers, they show more concern. And they as well are not able to see their friends. Also spending more time on the phone or playing games. That's also a sign of anxiety. As you know that it's very common with deaf children developmentally and communication issues, I want to emphasize that more than 90% of deaf children are born to hearing parents. And out of that 90%, 88% of those parents don't know sign language. And that's what I'd like to emphasize. As you can see, the list that we have there impacts. They have language deprivation, isolation, they don't understand socializing boundaries, and that tends to lead to an increased risk of abuse. The people that they trust are the ones that abuse them or neglect them. Of course, the past slide mentioned this, and what was mentioned in there leads to all these issues that we see here, all these mental health issues, struggling, depression, and not only do these issues stay with them during their youth and their childhood and their youth, but it also stays with them through adulthood. that language deprivation, they lack a relationship with their family, they lack the sense of feeling safe, um, and they tend to feel lonely. So how coronavirus or COVID-19 impacts the US's welfare system? The child welfare system has a long struggle with a lack of clear program structure and overall philosophy. So federal government has policy set up where there's child welfare system is composed of the public agencies, private entities, and community-based organizations. So these two priorities are difficult to reconcile since it is imperative to make sure that we try to keep both. Sometimes, we take them away from the parents, and we know that this impacts the child, because studies have shown that children do suffer when they are removed from their families. So the federal government puts this responsibility on the states, and every state varies. If there is sexual abuse, neglect, a variety of different situations happening, it is reported. Not only in California, for example, I'm pretty sure they have the same core of child abuse definition, but the point is that it actually varies from state to state. And ultimately, the goal is the child's safety and their well-being. The goal is to try to avoid any neglect or abuse from happening. And I'm sure that you have heard that research has shown that when children are removed from the home, they suffer. But, even though they're put somewhere, or if they are returned to the home where they're still in danger, they're still suffering. And ultimately, it is at the discretion of the social worker to decide what is the best thing to do with this child. There's no doubt that with COVID, there is no doubt that the child welfare system is being hit hard by COVID-19 and this pandemic that we're all suffering through. The emergency system has also called attention to how this system can benefit from fundamental change. It's the same idea as what's going on in our world right now. It takes a death of someone to make a change in the system. Now we see all this information coming out, so hopefully this will help the system to change. So here we see data, child abuse and neglect data for hearing and deaf children. And we know that there's a lot of data out there for hearing children, but we want to focus on the data that we have for deaf children. Deaf children are more vulnerable to neglect, emotional, physical, and sexual abuse than in the general population due to the lack of communication access. They're unable to speak up in defense for themselves or report effectively to their caregivers. 50% of deaf girls have been sexually abused compared to 25% of hearing girls. That's a big gap that we see there. 54% of deaf boys have been sexually abused when compared to 10% of hearing boys. Something's wrong with this picture. And of course, it's because of their lack of communication. So individuals with disabilities are over 4 times as likely to be victims of a crime as the non-disabled population. And the last slide relates with this slide. And I wanted to explain a little bit more about the risk factors. So deaf children are taught to be compliant, often without understanding what they're being asked to do. by a wide variety of adults in a diverse array of contexts. Children are just taught that, you tell them what to do and they respond. Many children demonstrate reduced communication skills that both increase their risk of abuse and their ability to report abuse. The ability to be able to say, hey, somebody's hurting me. In addition, parents and professionals lack the awareness of the increased risk and the subsequent lack of education for children regarding sexuality, personal safety, and their right to say no. Maybe, them not having the skill to be able to express themselves, not having the language, the proper words to explain what they're feeling. They don't know how to say no. They don't know what are the appropriate boundaries when it comes to sexual activity. They don't have any safety skills. Signs of potential abuse or neglect. I think that we're all aware of these and we all know these, but I do want to emphasize a few things. That it's important that if you recognize something, you know that it's a good student or a good child, but you see things that are a little bit more different than normal, instead of saying like, oh, he's just a kid, that's why. Oh, it's just teenage behavior. Oh, they're in a mood. They're being grumpy. So I think that it would be best, my suggestion is to check in with them. Check in. Maybe there's something going on. Also, we see that now more and more when we notice any kind of animal abuse, that can be a sign of something going on. Maybe somebody in the family's hurting them. There's been children that hurt their animals or even kill their animals, and that's a red flag. And I know that a lot of you work as mandated reporters, maybe some of you don't. So who is a mandated reporter? A mandated reporter is one who is required by law to report any reasonable suspicions of abuse. And I want to emphasize that it's not your job to investigate, to question the child, tell me this, tell me that. That's not your job. If the child makes a comment, somebody hit me, somebody's abusing me, there's some sort of sexual things happening, then you are to report it to the proper authorities, and the proper authorities will come and conduct an investigation. You did your part. You just report it. If you have any suspicion, then you report it. So who tends to be the ones that make these reports most often? Of course, teachers, principals of schools. And the reason for this is because children go to school every day. That's where they're at. It's their safe place. They're there with trusted adults. They chat and they have more contact with these people. That's why there's high percentage of reports made from these people. And in the next slide, I want to show you the statistics of percentages of who actually reports. As you can see here, it says 67% of professionals make reports, mostly educational personnel, 20%. There's other, sometimes neighbors, families, extended families who make these reports. But right now, with coronavirus happening, these numbers have dramatically declined. And there is a concern because children are not in contact with these educators due to the school closures. It's hard for anybody to see if there's any kind of abuse or neglect going on. They're living with the abuser and they're in home with the abuser. Maybe the abuser is watching them. Maybe the abuser is listening. So it's a big challenge for a lot of these people that are working with these children. This graph I want to show you, it shows from 1990 to 2017, and it's the number and rate of child maltreatment. And as you can see that the numbers were slowly declining, then it kind of stabilizes and it levels out. And during that period, we see that this data is to show audience how serious in the past and how it was reduced due to psychoeducation, children and families receiving services reporting, but now with COVID-19, it will skyrocket. The period when sexual and physical abuse started, the dramatic downward trend was marked by sustained economic improvement. Increased in the numbers of law enforcement and child protective personnel, more aggressive prosecution and incarceration policies, growing public awareness about the problems, and the spread of new info on the treatment options. One possibility is that neglect has not declined as much because it doesn't have enough public awareness like sexual and physical abuse. If it did have the same knowledge where it's well known, then perhaps it would decline. And this slide, how COVID-19 is impacting child abuse reporting, you can see the numbers and how much they've decreased dramatically. For example, in California, on a typical day, there would be up to 1,000 calls and reports of suspected child abuse and neglect. But now it's decreased by 50%. Maybe there's 500. In other states, for example, Missouri, we see a 50% decrease. And these are everyday calls. For Missouri, it would be around 650 daily calls. And now there's been a dramatic increase where we're seeing about less than half of that at 325 calls. So throughout the whole country, we see these concerns where the numbers of reporting have dramatically decreased. And with seeing these numbers, we don't want another Gabriel Fernandez case or Anthony Avalos, the two young boys who were killed after lengthy and repeated incidents of abuse at home. And that's the reason why this is very concerning. We don't want to see this happen again. And if you haven't seen, I suggest that you watch The Trials of Gabriel Fernandez on Netflix, a documentary series. Now I want to discuss a little bit about the unprecedented challenges Child Protective Services faces. Another concern is going out to investigate these calls. Children's ability to speak privately while they're at home when they do get a visit. You know, if it's done through video. And if it's something that is very serious, then they will go to the home. But, you know, sometimes the kids will just feel like they need to just keep it to themselves and not say anything because they want to be safe. I know that this is a challenge for many mental health professionals, therapists, and teachers, and mandated reporters to assess and to make sure that the child is safe. And the child feeling that they can't express themselves because they are being watched. It's also a challenge for children that don't have a safe place, that lack that communication, that feel like they're all alone. They're already in survival mode. You know, and imagine being in this situation with COVID-19 for 2, 3, 4 months, you know, and I'm sure that they're hoping and looking forward to the fall when school opens up again, where they can let all this out and have somewhere to feel safe and someone to talk to. The National Sexual Assault Hotline reported that for the first time ever, half of the visitors to the website were minors, and nearly 79% of reports of living with their perpetrators. And for the first time in its 25-year history, the National Sexual Assault Hotline and the Rape, Abuse, and Incest National Network are paralleled with the same report in regards to the half of the victims receiving help are minors. And the platform that they're able to use right now is the internet. And I'll explain a little bit more about that. To point out another thing, children who live with their abusers, let's say it was happening one time a week. Now that they're home 24/7 with the abuser is not going to work. It's going to happen more than that. Sadly, it is likely that the risk of the children being sexually abused will increase. One more tragic consequence of the public health crisis that the country already currently faces. So again, like I mentioned about victims and how they're able to use technology now even more and more through social media, texting, through apps. It's really amazing how much technology has changed and helped these victims be able to communicate. So this talks a little bit about an organization called Child Help National Child Abuse. This was set up last year, and it was a pilot program. They were funded with $2 million in grant services from the U.S. Department of Health and Human Services. The goal is to help Child Help elevated services and capitalize on new technologies to reach youth and deliver services where they are needed most, where they can speak to a professional counselor, and most of them successfully reported that this led to them being able to be on the website 24/7, which provides more options for them. More people who have experience with these children that are abused in their home. And it will also allow Child Help to study the services alongside Arizona State University Research Center to improve the future of the hotline and set the standard for other hotline services across the globe. In order to provide more access for these youths and for these children who are being abused. And if you know or you have concern that a child is being neglected or abused, they have professional counselors ready to chat with you, to ask you questions. They're there 24/7 via text, phone, chat on their, or to chat on their platform, which I think is really cool. So what does domestic violence or intimate partner violence have to do with child abuse during the pandemic? So intimate partner violence, I will abbreviate with IPV. Imagine the emotional impact on a small child of seeing this violence enacted against one of his or her parents. The short-term psychological effects are dramatic, including behavioral, emotional problems, social dysfunction, and cognitive delays. This also leads to long-term effects, including stress, depression, aggression, and substance abuse. Research has long been aware of the link between domestic violence and child abuse. Even if children are witnesses to acts of violence and not the intended targets, they can still be affected in the same way as children who are physically and sexually abused. They are affected in the same way. Since domestic violence is a pattern of behavior, children that may be victimized or threatened see it as a way of punishing and controlling the adult victim. Or they can be injured unintentionally when acts of violence occur in their presence, or some can include attacks on children. Even though they're not directly attacked, they can experience serious emotional damages as a result of living in this violent household, and they start believing that this is accepted behavior. This is normal. So the question is the stay-at-home order or social distancing safe for survivors? No, it is not. Obviously, we see that it's not. Abuse is about power and control. And now with COVID-19 happening, we see that there is even more and more power and control with excuses, scare tactics being put forth to these children. What the survivors shared with the advocates, as we see that with coronavirus, it scares many of these children. They become paranoid, they become worried, they're afraid. They are kept separate from children, or when their parents come home from, if they're a medical worker, then they're afraid that they're going to get the virus. You brought it with you. Impacts intimate partner violence or domestic violence survivors. We see here, there's a few things that I want to add. Some abusers are using the spread of COVID-19 in jails to persuade victims to feel sorry for them. You know, oh, if you send me to jail, then I might die in there from the virus. So then they feel bad and they won't make a report. And then the victim becomes concerned about the batterer going to jail and getting sick there. Also, another thing, that when COVID-19 was spreading in the jails, some of the people were processed because they were getting too full. They were processed quickly in order to control the spread of COVID-19 in the jails. So what does this mean? That the alleged batterers were being released much faster than usual, which makes it harder for the victims to make a safety plan before the abuser returns home. So there's a lot of negative impacts that we see for domestic violence and IPV sufferers and victims. There's so many different interventions for domestic violence and IPV survivors. Also, before coronavirus, you know, they were able to go to the park or to work, to meet with friends, advocates in order to discuss and make a safety plan. But now that COVID-19 has affected everyone and we're all sheltered at home, you know, their abuser might say, wait, where are you going? Who are you talking to? So discussing and finding a new hub to be able to help these victims. You know, maybe a grocery store where they can connect with these victims. Of course, healthcare providers can continue seeing if there's anything that they can do and search for any signs of child abuse or neglect. I'm sure that some of you still already continue to do that. And maybe school districts where they're providing free computers or providing technology for these students, can install some sort of app where a survivor or a victim can find a way to contact the police, or maybe putting something in the iPad or the laptop that they get instead of calling, where the abuser can hear what's going on and starts blaming them. Many domestic violence survivors are calling for law enforcement. Many domestic violence survivors calling law enforcement might be the last resort, and the services that they can and have been relying on might look different now, but they are more important than ever. The faces of coronavirus, this perfect storm. As we see here, these 4 pictures of these cute little kids, these cute babies, so innocent. I'm going to tell you a little bit about them. So, unfortunately, the overwhelming majority of child abuse victims are never written about or revealed to the public because of patient privacy. patient privacy laws and legal cases that result from the abuse. Usually the news of these doesn't come about or are not identified as the victims of abuse, not until after they die, and some cases are written about once they become police reports. So Kyra Andrews, 6-week-old girl, sustained injuries consistent with abuse head trauma caused by her father, who was already awaiting a trial for another child abuse charge for second-degree burns to the face, neck, chest of another child. She was injured in mid-March when the father was taking care of her while her mother was being treated in the hospital for an infection. Caden Blackmer, 2-year-old boy. He had just turned 2 years old, had a skull fracture, fractured ribs, brain bleed, collapsed lungs, caused by his mother. Caused by his mother's boyfriend, who was already facing the child abuse charges that were unrelated to Caden's death. The charges involved abusive treatment against Caden's 10-month-old sister. Detectives said they are waiting for results from the autopsy before considering criminal charges. Michael Fetterman, 3-year-old boy, who died after spending weeks in pediatric intensive care for injuries related to physical and sexual abuse. Police say Michael's mother's boyfriend, who attacked the child, left him with a fractured skull, brain bleed, injuries to the eyes and mouth, fractures, and significant bruising. Tasmir Ransom, a 7-year-old boy, was fatally beaten days after his 7th birthday, caused by his 26-year-old mother, who was charged for attempted murder, aggravated assault, and other related offenses. All of these victims of child abuse. And now with coronavirus happening, we see that these numbers will increase. So you see it says the lesson from 2008 recession. How does that have to do with now? So, they say that history repeats itself. And Dr. Rachel Berger, a child abuse specialist at Children's Hospital of Pittsburgh, was one of the ones who noticed these kinds of trauma injuries and started to do a study. Before, it used to be called shaken baby syndrome, but now they've changed that to abusive head trauma, AHT for short, which is one of the big concerns in regards to the 2008 during the economic stress, where we saw child abuse cases skyrocket during the recession. The average age of the children who were in the hospital was 9 months. It was discovered that the children died from abusive head trauma than from any other type of brain injury that year, which is remarkable and highly concerning. So how does AHT happen? Things like gently bouncing a baby on a knee or riding in a bumpy car won't cause these problems seen in abusive head trauma. It happens when you use force to shake a child, force to throw or drop a child on purpose. If the child hits his or her head or neck against an object like the floor, furniture, or hits the child's head or neck with an object. Shaking a baby is so harmful because infants' poor necks don't have the strength, and their heads are not large. Their heads are larger compared with the size of their bodies. So this lets the head move and the brain inside shake back and forth. When the head moves around, the baby or child's brain moves back and forth inside the skull, which can tear vessels and nerves inside the brain. The brain may hit against the inside of the skull, causing brain bruising and bleeding on the outside of the brain. Injured children were often brought in with parents waiting until they stopped breathing, and it ends up being a fatal outcome for them. These injuries can cause permanent brain damage or death. People should never shake a baby for any reason. Now we see watch for behavioral changes in a child. In this slide, we see that the biggest crisis in America right now is the one that's happening to these children. Every resilience factor for at-risk kids involves connections with people outside of the home. The mandate to stay at home is making those connections impossible. Without access to friends and activities and responsible adults, the chances of these at-risk kids being successful has plummeted. And the stressors on families have dramatically increased. Shut away from schools and peers, they are living with parents who have been laid off from jobs, and in a way it's caused also for alcohol sales to increase. And these sales have actually increased by 55%. And, parents at home drinking can possibly lead to violence being caused to some of these children. So maybe you already know what to do, how to communicate with parents, but I think the most important thing that I want to emphasize is trying to chat with these parents, coping skills for parents and caregivers, having a conversation and sharing your fears or concerns. Do not unload all of this on your children, but you have to show calmness, even though sometimes, you have a fear of anxiety, but it's important to show that you are calm and that you can explain things to them. Take breaks from watching TV, reading, or listening to news stories. Also, model calmness, maintain normalcy, listen actively and validate, help sit through anxiety, know the factors or direct towards facts. Watch closely and monitor for any obsessive compulsive disorder symptoms such as excessive hand washing. I'm sorry, we were having some technical difficulties. Like I said, take a break from watching news. Sometimes overwatching these news and seeing everything that's going on, the anxiety that you have can also be um, sent to your child. Your child is watching you and they pick up those feelings, those emotions from you. Keeping in mind that you're a model to your children. How you respond to this crisis and this situation, they're watching and they're learning from you. Again, the same with teenagers. Remember to model calmness. Keep things normal. Try to keep a sense of normalcy. And if you see some sort of anxiety or concern, discuss it instead of ignoring it. Sometimes you feel it's difficult to be patient with what's going on, but let's remember that teenagers and children need that. They need to have that full confidence that we can give them in making them understand that everything is going to be okay. Of course, keep the facts. Keep it with the facts. Don't try to give them wishy-washy stories and make them paranoid. I'm sure that once you start giving them certain information, their mind can spiral out of control. So know the facts and just direct things with those facts. Making sure that you watch them closely for any signs of obsessive compulsive disorder. For example, excessive hand washing, especially right now with the COVID-19 situation going on, having to wear a mask, having to constantly wash your hands. So making sure that you watch out for those kinds of signs, which can also be a sign of anxiety. Discuss it with them. It doesn't mean that they have a serious case of OCD, but if they do, then making sure that you take them to see a proper medical provider that can help them with that. Basically, your child is watching how you respond to this kind of a crisis, and you are the best model and teacher for them. So I added this slide, how to have a safety talk with your deaf child or a deaf child using video relay services. It's important that you don't say, oh no, I can't communicate with my child, so I can't. No, try your best. Try the best that you can. Try to figure it out. I also wanted to add, if you're not aware of Wavelo, it's a new app that was recently released, which I think is really neat. They have a live interpreter that pops up, and you can call the person that you want to speak to so that the parent can see them or the other adult. I think that's another great resource that you can use for children who want to communicate with their parents. But, understanding that the same rules apply as VRS services. If there's two people in the same room, they cannot call each other. They have to be in separate rooms. Another option, this could be another option for them. Listening to your intuition, making sure that you're like, no, I don't think so. No, listen to your intuition. If you get that gut feeling, then follow through with it and ask. And it's crucial for any parent to learn how to communicate at an early age. Also, making sure that you get an ASL interpreter that can communicate clearly, that has experience with working with children. If you get word that the child is being abused, then you can bring them to a medical provider, a mental health professional with a qualified ASL interpreter. And I want to make sure that I emphasize that. Also, I want to emphasize that parents should learn how to sign at an early age. Once you find out that their child is deaf, then, making sure that they try to make every effort possible to learn sign language. Even if they do say, oh, I want them to learn English, I think that they need to understand that this miscommunication is going to affect their relationship and their bond. Interventions for anyone who works with families. I found a few things that I thought were really neat. Maybe you've already heard of these, maybe you haven't, so I thought I would share them. Asking children about their pets. How are their pets doing? Because animal abuse can be an indicator of child abuse. Making sure that if you do see these signs, trying to ask more questions about what's going on at home. Playing a game that involves physical movement, such as follow me or show me your house. I got a tip also, how to interview children. You can ask, hey, why don't you move around, copy what I do, or hey, I'm going to do this move and you imitate me. That way you're able to see if there's any signs of any bruises when they are following you or imitating you. And when they're showing you your house, they're walking around the house. So you get to see room from room. You can see who's there. You can see what the rooms look like. So I think those are good options now that we're doing these telehealth and these video calls. Not only asking parents and caregivers to ask their children about their well-being, how they're feeling, what they're doing to cope with the current situation, what they're thinking, helping them process their feelings of anxiety through COVID-19. And I know that some of these mental health providers are already doing these things, playing games, asking them to tell stories. Another option could also be some sort of scavenger hunt. Oh, you know what? Get me something blue, or go look for something this color, or find this ball, and sometimes maybe they start sharing more with you. So the bottom line is understanding and knowing that we need to be a resource for families, and telling these families that we're here for them. We can provide resources, information, services, food banks, therapy services in order to support the family and lessen the stress that they're going through. And again, the same that has been being said is to have open communication. Communicate honestly and openly. Share information about what is happening in a calm and factual way. This is something that will help decrease their anxiety. Yes, I know that right now we're ordered to socially distance, but I've seen that some people have forced their kids to stay inside the home, but it's okay to go outside. It's important to make sure that you're safe and you're socially distancing, but you do need to get out of the house because if you stay inside the house, you're gonna go crazy. So after COVID-19 is over and we all go back to living some sort of normalcy, expect a surge in child abuse reports. Right now that we see that contact with students has um, stopped, there isn't anything being reported, but we know that once we go back to work, there's going to be so much work for everyone to do to keep every child and youth safe. If you or someone else suspects a child is being abused or neglected, DCFS encourages you or them to call their child abuse hotline in your area. If it's a neighbor and they say, wait, I don't know if this is going to be confidential or not, reassure them that it is. If they notice that something is off, something is strange, something is different, encourage them to make a report. You will be saving a child's life. Here's a slide with some resources for you. If there's any questions, feel free to type them on the chat, or you can email me. I'm sorry, I was really trying to condense all the information. I hope that you left with something that you learned, something that you can use with your children or your youth in who you're working with. Thank you so much. Bye-bye. Where are the questions? I'm looking for the questions. There's a question with a decrease in child abuse reports numbers represented both deaf and hearing children. Yes, it's for deaf and hearing in general, just all children, for all children. But you know, information, the numbers are increased for deaf children. Number 2 says, how do deaf tweens or teens cope with their anxiety at home, especially if they have limited communication with their families? There was a slide that I shared. You know, it's very important to try to communicate and maintain some sort of normalcy. Just keep a routine, try to keep things like another day, you know, and sometimes they might experience some sort of anxiety, feeling insecure, you know, trying to do things with them, trying to talk, trying to be open with them. Number 3 says, how does it work with deaf children with ASL as their first language who are seeking help or support via chat platform? So, you know, maybe some of them can type, a lot of deaf children text, but also they do have a video phone, which is available for the deaf. There's also different programs that they can get access to these video phones if they need it. Can you share your slide deck? I hope that I answered all of your questions, and if I didn't, then please feel free to email me and I'll be more than happy to get back to you. Any more questions?